In this section of the Movement Principles lecture, we will finish up with section 4, which with the American College of Sports Medicine guidelines. Just recently, CNBC released a statement stating that according to the U.S. Department of Health and Human Services, most of us are falling short of the exercise guidelines. In fact, only 26% of men and 19% of women and 20% of minors are getting the recommended amount of exercise. This leaves so much room for us to really help our population and our community and hopefully strive at helping our youth then turn into better exercises in their adult life. We need to address this as something definitely that is at the forefront of our society and has become a pandemic for those. And well, guys, once you become parents, you're going to understand it's really kind of painful to watch your children have to sit all day at school. And I think most of us have gone through a DPT school where we have to sit a lot too, and just the effects of sitting and not moving is just so detrimental to us. So what are the guidelines? Let's dive in. This is really going to dive into really the American College of Sports Medicine guidelines. There are several other bodies out there that are setting their own guidelines, but they're all very similar. And so for us, we're gonna base our programming and our thought process based on the American College of Sports Medicine. They've done a lot of research. There's a lot of great resources for you guys there. Suggest that you visit the website and you can look under position stance. They have a lot of exercise examples for your patients and your clients, and even for you. We've listed some of those on our course shell, so you guys can check those out. Like they have a strength training guideline and an aerobic guideline and some really great resources, so check it out. We're going to start with a FITT application. We're going to expect that you guys will apply this when you are designing your programming, and that you think about this when you think about your overall arching goals for your patient. So frequency, how often are they performing said exercise? Intensity, how hard? So this can be on multiple levels. You can use the perceived exertion scale, which we'll have a picture of later on. You can also work based on their 1 rep max if you're thinking about strength or a 10 rep max. We also want to think about time. So are you programming a 30-minute, 60-minute? This can also be the time of the exercise. So is it 3 sets of 30 seconds? The type is the type of exercise. Are you running? Are you biking? Are you swimming? And then we also are going to apply the VP. So the volume, that's probably one of the biggest learning lessons for you guys, is to really look at the volume of exercise on a specific muscle group that you might be targeting. And then are you able to progress and advance the exercise? Remember those principles of exercise that we have to have overload and progressive overload to see change. This is it in a nutshell. So one of the easiest ways to think about it is you have to have 150 minutes of moderate aerobic exercise a week. So you can break that down. Most recommendations are that you get 5 days a week of at least 30 minutes. And this will change what that definition is for people. So I remember being in college and being able to work out hard every day. I mean, I probably worked out 2 hours a day. And then after having kids, full-time jobs, I had to adjust what that meant for me. And 30 minutes of brisk walking sometimes is really all that I need and all that I get in that day. And so I had to accept that I'm still meeting that. I might not be meeting my overall arching goals, but that's a good base for me to know that I'm actually meeting some of those expectations. You can do higher intensity. So you can do a higher intensity aerobic training, but you have to keep that rate of exertion very high for 20 minutes. Strength training, really we're going to change that to muscular fitness, and you'll see that as we move on in our slides. It's really 8 to 10 exercises, so thinking your major muscle groups, 8 to 12 reps, 2 to 3 times a week. Flexibility, 60 seconds or 10 minutes for most of your major muscle groups. And then neuromotor, which we'll dive into a little bit more, but that's thinking about balance, agility, coordination, gait exercises. That should comprise 20 to 30 minutes, 2 to 3 times a week. That can just be incorporated with some of your other exercises that you're doing. It doesn't have to be in addition to. So muscular fitness, the definition is ACSM defines that as our strength, our power, and our endurance. So muscular fitness doesn't mean that we're just striving at one. If we are striving for one, we're probably going to have to tweak our programming a little bit. They do suggest resistance training. We talked about that in those previous slides. But just understand 48 hours of rest with that muscle group that you're working. So if you're doing more of your phasic, bigger global muscles, and you probably need to give those a break every 48 hours. If you're doing more of a neuromotor or like a postural reset, those exercises can be done every day and probably should be done every day so that you get neuromotor retraining. Those are two sets of different exercises, so I want you to bucket them differently. This is important for you guys to know because it's really helping you with when you have a novice, you're probably going to do total body. You're going to try to maximize their time, often design circuit trainings. When you get someone intermediate who's maybe going more for strength or more for hypertrophy, you might add in an additional day, or you might break it into 4 days a week of strength training so that they're getting more gains. When you move into that advanced, you're really thinking of more of a split programming phenomenon for them, where they're working 1 to 3 muscle groups at a time, but they're doing multiple exercises to reach that high volume needed to achieve their goals. Elite, they're probably doing twice a day, and they're doing workouts 4 to 5 times a week. There's lots of different ways you can do resistance training. We recommend that, and so does American College of Sports Medicine, that if you can do multi-joint exercises, that's usually what you start with. They require more energy, they require more control, and then once you use those, then you can move to some single joint exercises. So single joint, you would think of just a strict bicep curl. Like a chest press would be multi-joint. You're moving your shoulders and your elbows. You're asking stability at your wrist. You want to target agonists and antagonists. It's a great way to start your programming when you want to design a circuit. You might think, okay, I'm going to do an exercise for the agonist, so I might do a quad dominant exercise, and then I'm going to do an exercise for my hamstrings or my antagonists. You want it to be comprehensive, so make sure you're addressing kind of all aspects of the muscular fitness that's needed. Just broke it down for you guys here so you can really see what some of the differences are. Strength, if you notice, what's the difference between muscular fitness and muscular strength? First of all, it's typically more sets and it's less reps, so it's a lot heavier. You have to achieve failure to then progress and adapt and improve your overall ability to perform that. If you want hypertrophy, you want to think about it's multiple sets and it can be up to higher reps. You're going to think that this actually needs to probably have higher volume too. So hypertrophy, you want bigger size of muscle. So you're thinking that you have to have multiple exercises to achieve that. Power, so think about power clean, snatch, even squatting, deadlift, those can all train muscle power. That's really very low reps. It's higher velocity, and it can be multiple sets across. Muscle endurance is the one that I want you guys to think about. A lot of times people prescribe 3 sets of 12 for muscular endurance. We're probably not hitting where we need to hit for neuromotor training. You actually probably need to get upwards of 15 to 25 reps. And when you get into this, you can start to train time rather than repetitions. This will help you. I'm going to let you guys analyze this on your own, and I want you to make sure you understand and have memorized how much percentage of your rep max each of those requires. That helps you when you're picking your starting weight for your patients. And then think about your rest between sets. And when we say rest, that actually means the agonist. So your agonist is that's what's resting. You can always work the antagonist in between and set up a circuit that way to maximize time for your patient. Make sure though, if you're trying to go for muscular strength and muscular power, a low load active recovery is okay to do, but you can't probably do another strength exercise or another power exercise. It will start to diminish some of your gains that way. Okay, this just kind of breaks it down for you guys a little bit more. Muscular strength, when you think about a novice, they're going to come in and they're not going to be working at that advanced load of their 1 rep max quite yet. They're going to have to work at 60 to 70% of their 1 rep max. Their volume is going to be probably only 1 to 3 sets. You're not going to get into higher sets and reps. Err on the side of caution. If you've got someone that's never come in before, you might want to err on the side of doing 1 to 2 sets. Watch their form, watch how they're performing. The rest period is going to adjust based on what you're prescribing for them. I want you guys to practice some of this. Practice designing that, thinking about a few different people that you know about and how to design a muscular strength program specific for that person. Perhaps take someone in your family that isn't really exercising. It's coming up on the new year. Maybe you want to give them the gift of designing a program for them. Then think about someone who's been exercising frequently and how you can change or tweak their programming to be that much better. Power is 0 to 60% of that 1 rep max. So it's lower, but right, what's the difference, guys? There's speed. This is where you start to incorporate your sport or your work needs. I had a gentleman that he worked for Wonder Bread, and he had to lift these huge trays up high. So it was almost like he was having to clean and jerk these big trays of bread. And so part of his rehab was actually doing some of that functional training with speed because he had to go fast. So think about that. This is where you want to make sure you're getting enough rest and recovery so that the next sets that they do are really effective for them. Hypertrophy, let's get big. We want those curls to get the girls, right? So this is where you're thinking about, especially for advanced, you're doing multiple sets of maybe that one specific exercise, but then you're doing multiple exercises for that one muscle group. So you might do regular bicep curls, then you might do preacher curls, then you might do cable curls, but you're doing multiple exercises for that one particular muscle group. Muscle endurance is the ability to repeatedly exert a submaximal force or resistance. So this is what I want you to think about when you're doing core strength training or core stability training. We shouldn't even say strength, right? We say core stability training. If you think about core strength, we want to maybe incorporate that with some of our bigger power exercises that we're doing. But our muscular endurance, this is where we're working on a lower load, but we're asking more for time and more for higher reps. We want someone to have that prolonged ability to hold that. You might do some iso hold. So if you look at this guy, he's almost in that bear crawl position, right? So maybe he's doing some bear crawl type of phenomenon over time, building up to doing that minutes at a time. You don't want to get your patient bored. You're not going to have him bear crawl for 2 minutes. So you might have him in the same position, but a different exercise that you're asking. Same demands. Okay, so this is how you design a program. You have to have some type of warm-up, dynamic stretching. So there's multiple reasons. Why do we warm up? What would be some of the reasons? Well, we want to get our cardiovascular system going, right? So increased blood flow. Increased blood flow is going to increase the hydration and activation of our muscles. So that's a really good way. It's also going to activate the neurological system. So we went to do some screenings at Ironwood High School for their cross-country team. And when they did their warm-up, they started with skipping. And part of our education to them was that we're going to start you in a lower intensity. We don't want you skipping. We don't want you jumping and bounding first. We want you maybe doing some of your dynamic stretching, your inchworms, your walking anterior lunges with rotation, and then get into skipping right before you go into that. So it preps the system to do that. We wanted them to mimic what they were doing. Then we want to think about the meat of your programming is your conditioning for your sport or for your rehab component. So we're thinking about task specific, you're acting locally, but thinking globally. And then the cool down is a great place to add in some of your flexibility training. So maybe you do some yoga here, foam rolling, some self techniques, myofascial release type of phenomenon. You're going to have a whole lecture on aerobics. So this is just a brief introduction for you that aerobic training, your moderate is considered 40 to 60% of your heart rate max. And vigorous exercise is 60 to 90%. So you want to think that we want to keep that level up, especially when educating someone. They might think that they're doing a 20-minute very vigorous exercise, but come to find out it's maybe more of a HIIT exercise, where total in that 20 minutes, they're only working at that 60 to 90% 10 minutes. They haven't quite hit it yet. So helping them with adding more time or understanding that's vitally important. Then you're going to scale back for your deconditioned. So it's okay, 30 to 40%. Let's get some of that activation going. Let's get some of that blood flow going. Walking around the block might be enough for them. They can break down that 30 minutes into 10-minute increments, and evidence shows us that's still effective to do that. We know that this is going to improve multiple things across the board, and we really want to strive at that for our patients coming to us. This is just a way in which you can estimate the heart rate max exercise intensity. Okay, so I want you guys to go through and practice doing this for your 45-year-old male. Desired intensity is 70-80%. So you're going to think about the heart rate max times the desired percent. So go ahead and when you guys get a chance, you're going to calculate that for our guy. Okay, just a self-practice. These are different scales that were used. So the Borg scale really was all the way up to 20. But we know that was kind of hard for patients and clients to do. And so it was revamped. So we use the 1 to 10. It's really helpful with a lot of different things, but it helps someone understand. The 1 to 10 does correlate with where they sit at, typically with their heart rate. So if they're telling you that they're at a 6, studies have shown that they're working probably around to 60% of their heart rate max. So it's a great scale to help someone understand. METs is something that we need to understand as practitioners. It helps us understand what different exercises might be for them. Like rowing is very high in the METs required for that. Running at 7 miles per hour is 11.5 METs, whereas walking or jogging at 4 miles an hour is 5.0 METs. So just helping us, sometimes there's more bang for your buck. Cross-country skiing, phenomenal for you, and very high on the MET level. Something like gardening or vacuuming, going to be on the lower MET level. Still get some credit for exercise that way, but just maybe not enough. So this was what was the new position stance in 2015. The American College of Sports Medicine, they basically took away the requirement to go see a doctor before you exercise, because that was actually inhibiting so many people from actually starting an exercise program. So there's a quick, easy way when you guys are designing your programs, make sure you've gone through this. A lot of people coming to this have already gone through that. It took away the hazards of exercise-related cardiovascular events and takes it into account, understanding what's safe and effective, and that maybe if we're going to do vigorous, we might need to get clearance, but for someone that doesn't have any cardiovascular signs or symptoms, you're okay to start exercising. Muscular strength and endurance testing. So you can use your 1 rep max, which is really unlikely. Probably not going to do that in your programming. But what you can do is you're going to start with that 4 to 8 rep max. So you're going to see how much they can do. You're going to start for fatigues, watch for compensations. And if it's way too easy, then you know that's not where you're at. So once you get that, then now you can program for the rest of what you're trying to do. Okay. We know that you might need to look at someone with deconditioning or just multiple comorbidities. You might have to increase that. You might have to give them like a 10 or 15 where they're working with very, very low weights. So like 1 to 5 pounds for the upper extremity, and thinking about that. And just a reminder of the contraindications. You guys have to memorize this list and be ready to talk about it. So just keep that in the back of your mind. Spend some time going over that. So just a little side notes on some evidence of some strength training. When they looked at someone who was untrained and they started a muscular fitness program, the gains with 60% of 1 rep max, or approximately 12 rep max, 3 days a week, they showed gains in every muscle group. So what that says is if you haven't done it, you have really great potential to do it. They looked at a novice training 2 days a week, and what they showed is that they reached 80% of strength gains versus working out 3 days a week. So if they worked out 3 days a week, they maximized their strength gains versus working out 2 days a week, but we might still take the 2 days a week to maximize those strength gains. What does that tell us with our patients? Well, if they can get into a program where they're doing it 3 days a week, they're probably going to get better faster. 2 to 3 sets are better than 1. So they basically looked at what the effectiveness was looking at. So if you did 1 set of exercise compared to 2 to 3, 2 to 3 showed significant more gains in strength than doing 1 set. But once you got into 4 to 6 sets, you saw minimal gains after that. You still see gains, but not as much. So really that's where our 3 comes into play, that we know that that's kind of our part where we're getting the most out of that. Active rest. So what they did is they did a power exercise, and then they did an active rest, so very low level bike riding. And what it showed is that there were significantly lower blood lactate levels in that athlete, and that they had an increased ability to perform the exercise if they did an active rest versus no rest in between their sets. So help your patient maximize their time doing some of that lower level exercise. Isolated exercise did not add to benefit to program when performed with compound exercise. So what this means is multi-joint exercises are much better than isolated exercises for gains. Making workload alterations. So 8 rep max, 6 rep max, 4 rep max, every workout was more effective in eliciting strength gains than doing so every 4 weeks. So what principle is that? That's our variety principle. So thinking about changing some of that for your patient is really going to help you guys maximize your time with them. Okay, here's our recommendations. Do a light aerobic warm-up combined with dynamic stretching. Work your large muscle group first with compound exercises. Think about opposing muscle groups for supersets. Do some of your isolated exercises at the beginning, very beginning as part of your warm-up, or at the very end, so that you're maximizing some of your more compound strength gains. And then do a light cool down or do some yoga for your cool down. We'll talk more about power and agility and plyometrics. That will come later. All right, you guys, great job. Finishing section 4. Know there's a lot of information, and good luck memorizing it, but we know you can do it.